policies. As an advocate, we advocate on a national level as well as a state level. I'm also on the board of a national advocacy organization, and they've recently been submitting and speaking with the Center for Medicare and Medicaid Services, CMS, to work on that plane. And we're working on the state level, both Dignity Alliance and Mass Advocates for Nursing Home Reform. So visitations were prohibited in nursing homes for about 5 months, from mid-March to mid-August, an eternity, an absolute eternity for nursing home residents and their loved ones. And when you think about it, some of the folks that live in nursing homes, they were not able to avail the electronic means of communications, either because of dementia or possibly a hearing or sight problem. So it really was, for some people, a complete break from their loved ones on both sides, So it's extraordinary. Now, just a couple of weeks ago, the Centers for Medicare Services relaxed the open visitation, visiting outside. That started a month or so ago. And it was somewhat successful. But the problem with those policies and what we're experiencing now with the newest policy of being able to have an indoor visit is that the facilities are not required to do this. The language says may, and it is guidance. We're not talking about regulation. So this is temporary guidance. And we understand that there has to be some fluctuation considering what's going on with COVID. But nevertheless, it puts all of the cards in the nursing home hand. So what can you do to gain visitation in that situation? You can go to the ombudsman. He's a long-term care ombudsman, were authorized by the Older Americans Act. It's a national program. And their sole purpose in life is to advocate for nursing home residents. So please do call them for assistance if you're not accomplishing visits. In the newest CMS language, they were actually making reference to, there's a regulation, nursing in the nursing home books, if you will, that mandates visitations for nursing home residents, okay? So that has been relaxed during this COVID situation. But now the Centers for Medicare, CMS in short, is saying that you can rely on that regulation. There has to be certain circumstances, like the facility must be COVID-free for 2 weeks, and there must be a COVID low frequency in your community. But under certain circumstances, the nursing home must allow visitations. So that also your ombudsman can help you with. And also in the disability world, the Americans with Disability Act also provides some support for visitations, no matter where the location. If you're in assisted living, if, you know, of course, nursing homes, rest homes, wherever your location may be. If you think your ADA privileges are being denied, then yes, please do invoke those safety measures. We have received calls on our 800 number from a wide range of issues. What we did find out how severe those first 5 months were, and we're holding our breath. going into the winter months now. Will they go back to being that severe? And we sincerely hope not, because the isolation was causing medical issues with residents. Some we fear have died from malnutrition. We've heard of many cases, bed sores. There weren't enough staff. The staff themselves were coming down with COVID. So we're sincerely hoping that the facilities, and this is what we'll be fighting for, to keep visitations safe, still allow them. We do feel that it's very doable with the right PPE. Have the visitation in a common area. Some people may have to have it in their room, but most will be able to be moved to separate location. And so that's what we're going to be fighting for coming.
Thank you, Arlene. That is, and thank you so much for the practical advice there. It does seem like awareness of policies, awareness of rights is so important in that space. And Lachlan and Anna both just put in really helpful resources into the chat. So thank you for that. And I also think your point, and Lachlan wrote in about this a little bit earlier too, about the true health and medical impact of loneliness and of isolation. And I was really touched by the new CMS guideline language that really spoke to that and said, we are recognizing that these 5 months have had incredibly negative impacts on people's well-being. And thank you for all of the work you're doing to make those resources more available.
Right, well, I do want to say one last thing. My colleague and dear friend, her son has been in nursing home for over 25 years during accidents. She could not see him for those 5 years. And so what she said to me is, this is how she operates. To the world, you may be one person, but to one person, you may be the world.
It's beautiful. Thank you, Arlene. And